All right, take it away.
Awesome. Thanks, Lindsay. Awesome. Hi, everybody. This is so awesome. And I wish we had figured this out, on the 13th of March. So we could have talked to some of you at the beginning of all of this madness and kept everybody up to date on how things are going. But this is a really quick conversation, but we just want to start. I want to start by saying thank you so much. Lindsay was chatting as we were logging on today about how this is probably the first time you've actually seen people or even seen people without masks on. For me, one of the things that I have missed and hated so much in the last few months is being able to help with some food sorting every once in a while, to be able to walk around the warehouse and chat with people. And as things escalated and have gone in peaks and valleys, I feel like I have been locked in my office on Zoom calls dealing with all the political and media pieces of this crisis. But I just want to say thank you so much. Every call that I am on, whether it be with municipal leaders, politicians, with the media, with our community partners, we try to let them know every single time that we could not do what we're doing at the food bank to support this amazing network without all of you, without our volunteers. And I know Lydia and Kyle and Melody and Annette and the rest of our team try to say thank you as much as they can, but I don't think there are enough thank yous ever to say how grateful we are that you guys continue to step up and do everything you can to make such a huge difference. I wish we had an hour because I would share with you 10 months full of stories and thanks from our program participants on the front line, to the guys who live at EB Village who were so thankful for prepared meals at the beginning of this, to the food hamper program staff who really were in a tight spot in March and April and needed us to step in to pack their hampers for them. There's just so many incredible stories and thanks, and you guys are a really big part of it. So thank you for that. As we move into this stay-at-home phase of the pandemic, this is really different than the lockdown that we experienced in March and April for a number of reasons. And any of you who are around in March and April, you've probably already started to notice that. The first thing is we kind of know what we're doing now. We didn't in March, so that's a big plus. But I think the big piece of the puzzle is the rules and regulations are constantly changing. And the state of our community is constantly changing. Some people may have heard in the last couple of days, there are some small outbreaks in some of our shelter and homeless populations. And that's the first time since March that any of our programs have been really impacted by this. So things are getting a little tougher. So we want to get a little tougher with how we're approaching things at the food bank. So for those who don't know and may have questions about essential work, we were declared by the province of Ontario as an essential service back in March. Under the state of emergency orders, food distribution and food banks are part of the essential work that needs to be done in the province. We are also a key part and a very important part of the region of Waterloo's emergency pandemic management plan. And I actually chair the food support group as part of that pandemic plan. So I'm on calls right now every other week with politicians and municipal staff to provide them with updates about what's going on in the food piece of this puzzle, and also working with our staff and volunteers and our community partners, our network of programs and agencies, to be filling gaps out in the community as things shift and change. So that doesn't change under stay-at-home orders at all. We're still essential. We're still important. We get to come in. Your role as volunteers is considered work. So under the provincial order, it actually very specifically says working or volunteering in an essential service is allowed during the stay-at-home order. So you are totally allowed to come to the food bank to continue volunteering. And the one thing, and Lindsay and Annette and Kyle and Lydia, I've lost track of the agenda. They're going to talk about some of the specifics. But what I want to tell you today is, as we're giving you information about the specific protocols and the specific rules, we want you guys to feel empowered and not be afraid to enforce our rules. We know that over the last 10 months, there's been lots of situations where you've had people at the back door who've wanted to come in and have their picture taken, and kids that want to go on tours, and really, really kind, amazing community donors who want to unload their own food donation. And what we're going to share with you today is some really, really strict rules that have to be followed. We are no longer letting anybody in the building, with very limited exceptions, like service workers. So if, you know, we need a plumber or an electrician, they get to come in. But most of our staff now who can work at home are working home, and we are really locking things down. And that's to keep you safe. That's to keep our staff safe, but ultimately it's to keep our community safe. So we want you guys to be empowered to help us enforce those rules. And we're going to go over some of them today. And then if you have any questions at the end, Lindsay, if we have time, we could probably even use the raise hand feature as well. And if there's any specific questions about our role, we'll try and answer it. And like Lindsay said, if we haven't answered your question today, please send them to Lindsay. And we'll definitely go through all the questions that we can and get the answers back to you. So again, thank you so much for everything you guys are doing and will continue to do over the next few weeks as we get through this phase. And I will pass it over to, who's next?
I'll take it.
Will you take it? Back to Lindsay.
Back to me. Thanks so much, Wendy. There's a few things I have on my list here. Annette, I thought I would just take a couple of them off, and if you have anything to add, then you can feel free. So as far as the regular health and safety protocols that you've seen over the last few weeks and months, all of that is still in place. So that document that you would have seen in the volunteer newsletter, in your onboarding, all of those things are still in place with face masks, face shields for activities where distancing isn't possible, hand washing, and the sanitization that happens in our building by staff, that has not changed. There are a few additions. So we will be installing, and correct me if I'm wrong, but we'll be installing plexiglass dividers in the community room where staff and some volunteers take a break or lunch, just to add that extra layer of protection. Face shields still for the activities where we can't social distance. We had an email out to our driving teams about using them for when you're in the vehicle. A very valid concern was raised about, as the driver, that can be difficult if it fogs up. So the masks are definitely mandatory. If it's a safety issue for driving, then the face shield is something that you can remove. The daily screening is something you'll continue to see in your inbox every evening for the next day. There has been a question added around following the government guidelines in your lives outside of volunteering. So just have a closer look at that the next time you fill it out.
Be careful how you answer that question.
So read it carefully. Yeah, somebody had to correct their answer. We won't say who. And for the sign-up process, I just wanted to reiterate, when you're logging into your Better Impact profile and choosing your shifts, just ensure that you're checking back 24 hours after. Usually the ops team is really quick at approving or not approving those shifts, but just check your profile under the schedule tab to make sure what you've selected is there. Sometimes, just with everything changing so quickly and going day to day, we might not be able to accept, the amount of volunteers that we plan for, or things change. We do try to send an email. You might see an email from me saying, we had to cancel your shift or not accept it. Thank you so much for understanding. If that email doesn't come, it's just a good backup to refer to your schedule. Only volunteers on the schedule are coming to the building, which is what we see happening right now, but just wanted to reiterate that. Other than that, I think that covers what I wanted to talk about. Annette, did you want to add anything before we talk about some transportation updates?
Yeah, I'll just add, we actually updated the screening questionnaire. It's a little bit different. You'll notice when you fill it in for tomorrow, in addition to that question, just based on recommendations from the Ministry of Health, we've basically copied their recommended questions. So you'll see that updated. We, like Wendy said, we know what we're doing, and we have had a lot of great processes and protocols in place from a health and safety standpoint since April and then June. And then as things changed, we updated. you know, just with even in the front office, we had no office staff in, and then we kind of did a hybrid model where we had some scheduled to come in and we moved people apart. And then now that we're back to this state of emergency, we have everybody working from home. So we've continued to just adapt. And we've done that also with capacity for the warehouse. We shrunk capacity or reduced capacity during like the red and gray zones. But now that we're in a state emergency, we've reduced it even a little bit more. But you won't see that necessarily, I think, impact anybody that's coming now. We've got everybody staggered and staged, and if you sign up, then you're totally fine to come in. I think that's really it from a health and safety standpoint. The other thing with the new regulation of the state of emergency is our plans, that we've got all our plans documented, and we've kind of revised and updated them as we've gone along since March and as things changed. But we'll have our COVID safety plan, a version posted for everybody to see. So that's something we'll have for next week. So if you're interested in that, you can see that. And I think that's it, really.
The last thing I wanted to mention before I pass it to Kyle, you'll probably see my emails about the Volunteer Action Center link for the WSIB insurance. I just wanted to mention it again here for those who haven't applied. This coverage is for anybody with the recommendation between those ages 18 to 69. Even if you're retired, they're encouraging you to still apply because there are other benefits that can be applied. It protects you should something happen, wages. If you click the link, you'll see kind of a one-pager about what that means. It's a bit of a process with the application similar to what you filled out for the food bank. I know some of you joining us actually came to us through that process, which is great, this pandemic pool of volunteers. If you have questions about it or concerns or aren't sure why you should apply, please email me or call me, and I'm happy to walk through more detail. I won't take up too much time with it tonight, but it's great, just that extra level of protection that the regions have been able to coordinate through this state of emergency. So please reach out to me if you haven't applied and you would like to know more. And now I'll pass it to Kyle for a brief update about some transportation changes.
So for transportation teams, we have reduced some shifts from the grocery bin pickup and some of the food basic routes just to ensure that we are reducing the amount of people coming through, as well as that we have the right resources in the warehouse to make sure that we have everything completed. So we will be removing some shifts that some people have already signed up for. So we will send an email for stuff that has been signed up for next week that we've removed, but make sure you check the schedules to make sure that shifts are still on. And if there's any questions, you can reach out to me directly and I can answer any questions you might have. The shifts really revolve around the grocery bin, which we're only doing twice a week. So we hit every store once throughout the week. Rather than right now, we've been hitting them twice throughout the week. As well, the food basics routes, we will be going every other week rather than every week, just to kind of reduce the amount that we're seeing. So other than that, it's going to be standard sign up if you see the availability. We'll continue to communicate if shifts come available. And yeah, that's about it.
Thank you, Kyle. Melody and Lydia, I think Melody is here. I know she tested it for me. Is there anything in your role that hasn't been mentioned that you felt needed to be mentioned?
Nothing with regards to the warehouse, but I just want to reiterate the what Wendy said is thank you so much for all the time that you've helped and supported us in the last 10 months. And, you know, looking forward to seeing you all in the warehouse over, you know, whatever this pandemic stages will bring, and appreciate all your flexibility and changing with all the protocols and just continuing to come in and being amazing. It's truly an honor to work with each and every one of you. So thank you so much.
Excellent addition. There is a question in the chat, but I'll also let you know I haven't used this hand up feature in Zoom before. So if you have a question and you'd like to raise your hand, you can do that. You can enter it in the chat. And if I don't see you, you feel free to speak up as well. So Wendy, the question is, should we get travel letters stating that we do essential work sometimes?
So I discovered this morning after spending most of last night after I watched Bloodline, going through provincial documents that there actually is no mandate from the province about travel letters. I think it's an urban myth that got started by somebody, and so now everybody is jumping on board the travel letter bandwagon. So at this point in time, we are not doing letters. But one of the reasons is I was on a call, I was on the regional community support call this morning with our representative from Waterloo Regional Police that said it is not required. And if you saw any of the news pieces this afternoon and tonight, the chief has clearly stated that people will not be randomly stopped. Now, if you're speeding or driving erratically, you will be stopped. But there will not be random stops, and police will not be checking to find out where you are going. If that changes over the next few days and things were to escalate, then yes, absolutely, we will send you a letter so that you can have that. But it doesn't seem, from everything that I've learned so far, it is not necessary. And if we start hearing stories, I have the chief on speed dial. I'm going to call him and ask him. So you should be good. But if you were to be stopped, you just, you can, if you are registered for a shift, we will always, always, always verify that if there is an issue.
Anyone else have any questions? Taking a look to see if there's any raised hands or anything you'd like to add to the chat.
I just want to reiterate too, through the protocols that we have in place and the ones that we're adding, and I'm going to make Lydia and Kyle be the go-to. If you're in the building, and Melody, if you're in the building and you see something that you're not comfortable with, so if they're, we're trying to really limit traffic. Our development and communications team is actually getting some messaging out about not, encouraging people not to show up at the door with food donations, to go to the grocery store instead. But if you are, if you are concerned that people are dropping off food donations and they continue to get out of their cars, that they're not listening to you, we always say, be very firm with kindness. We're giving you permission to be firm, but be kind. But if things are making you feel uncomfortable, please make sure you talk to staff. And maybe it's a matter of, we need to change a sign, or we need to put a barrier up, or we need to put a pylon out to make you guys feel more comfortable. But we are not letting our visitors tell us how they're going to operate. We are in charge of our space. We are in charge of our protocols, and you guys are a big piece of that. So please do not hesitate to enforce the rules. I can't say that enough.
There's another question. How do I know if I've registered with WSIB? So this would be a specific application through the Volunteer Action Center, where you would have filled out an application that looks a lot like ours, same system. There would have been a phone interview, and they would have asked for a few references. If you haven't gone through this process and you are worried about the references, feel free to put our names down. I've had lots of conversations about lots of amazing people here, so that is not a problem. So that's the process you would have gone through. If you'd like to email me, I can send you the link and you can just open it and see if that's what you've already done. What types of groups are currently coming through is another question that we have.
There we go. Sorry, under lockdown, when we went from red to gray and now it's stay at home, we actually aren't doing any groups. Melody's canceled a bunch, and we've put a lot of people on a waiting list. And that will sort of ebb and flow as we get back into gray and red. Even in gray, we are really limiting groups to only have groups come in to do absolutely essential work. We have a really, really good supply of food, and we actually don't need to sort food right now. I would love to sort food right now because Annette could probably use some bins and some skids, but it is not a priority right now to sort food. And so until things get better out in the world, we're not bringing in large groups. We are really limiting the number of volunteers in the building, and you guys are the core of that group.
There's another question. I'm just wondering about the detail. Will there be a list of specific new rules in place that need to be enforced? I'm not sure if that was regarding volunteers or donors. I think it's just everything that for volunteer side, it's just everything that we've talked about tonight that we're really doing already with the schedule, checking your schedule, following the same rules you've been following. For the donors and people stopping by the building, there'll be some signage, and as Wendy mentioned, the empowerment to be firm but kind for those rules. So there will be not getting out of your car is one of them, allowing us to take the donation from the vehicle. We're opening the door just for that, so nobody's coming in, nobody's taking pictures. Besides that, and Liz has specified in the question, the protocol for donors donating on site. Are there other rules that ops team would like to mention further to that?
If I could just get, sorry, I was just going to give an example of the car for anybody who wasn't with us in March and April. What we were trying to do is that if somebody's ringing the buzzer or ringing the intercom, if somebody in the office is picking up the phone, they're giving them the instructions to ring the doorbell and get back into their car. If you open the door and somebody is still standing there, feel free to say to the individual, number one, they should have a mask on, but also say to them that if they could go back into their car, then we will come out and we will unload that donation for them. So we were really firm in March and April about telling people to get back in their cars. And for the most part, it worked out okay. So that's the safest and easiest way. If for some reason somebody does have to get out of their car because there's, you know, a dog or a kid or, you know, something in the back that they have to move, they absolutely have to have a mask on, or we do not expect you to be out there at the back of their vehicle if they are unmasked.
And we have the donation bin out there too. So we're really encouraging contactless donations. We have one in the front vestibule as well. So if people somehow come in through the front door, we don't let them in the building. We just, through a phone that's there, ask them to put the food donation in that bin. And like Wendy mentioned earlier, if you have somebody who could be a little pushy, or if you're ever really uncomfortable, just ask them to hang on a minute, shut the door, and go and grab Kyle, Melody, or Lydia to help navigate the situation. And as far as some of the specific rules, not a lot are different for the volunteers. Like you need to do the screening form before you come in. You need to schedule your shift. You need to wear a mask, a face shield if you can't physically distance. A lot of the other updates we've made are more specific to like other programs or protocols that staff manage. But like I said, we'll post that next week so you can look at it. And if you have any questions about it, reach out to any of us.
I see no other questions in the chat. Is there anything else at this moment? And you can always send questions to volunteer@thefoodbank.ca or speak with your on-site supervisor.
And one more thing about the door. One of the issues that we were having were people who saying, oh, I just want to pop my head in and take a picture of the total on the scale, or I just want to let the kids come in and stand next to their food donation. Absolutely not under this level. We will tell you when that is allowed again, but absolutely no way. We thank them for doing great birthday food drives, but no photos. We've been sending people to the sign. If people want a photo op, we've been saying they can go out to the sign, or they can stand in front of a truck and do their photo op outside in front of a truck. Works just as well as coming in the building.
I see Dawn's question there about fog sprays. I'm assuming that's for the face shields to make them more
Oh,
usable. So yeah, we'll look into that and see what we can get. We've been super lucky in that a lot of our supplies have been donated. So Canadian Shield has donated all the face shields we have in the building. I know a lot of people have also had the goggles. Those are ones I think people are personally bringing in themselves, but we can definitely look into some kind of spray or coating that could help with the masks not fogging up.
Yeah, if you have any contacts in the hockey world, they've
Yeah.
got it solved for years. I just don't know what it is.
Okay, sounds good. Thank you.
All right. Well, it's 7:27. Any other questions before we wrap this up? Hearing none. Oh, was that somebody? Oh, technology. Okay. Feel free to email, call, ask your supervisor. Thank you again for joining us tonight, last minute. Well, enjoy the rest of your evenings. Get back to your whatever you're binge watching. And that's what my plan is. And stay healthy and safe. And thank you all for being this wonderful community of volunteers, helping us support our neighbors who are struggling. And it's wonderful to see you all. And we'll do this again. I think it worked out well. We'll do this with some impact and some more facts and figures that is really interesting to share and update on everything that you're helping accomplish. So have a wonderful evening, and we will talk again soon.
Bye,
Thank you.
everybody.
Have a good night.
Bye.
Bye-bye.
Thanks. Good night,
Thank you.
everyone.
Good night.